and session. Go.
Hello, and we're live. Welcome, welcome, welcome. Right. Welcome to this rather cloudy but rather autumnal day in London. My name is Patrick. Apparently, I'm supposed to be chairing this meeting, but I won't. My colleagues will be messing in as well. Would you like to introduce yourself, Leila?
Sure. Hello, everyone. My name is Leila Reid. I work for the Hepatitis C Trust. We're a national charity working to address hepatitis C across the UK. We're a patient-led, patient-run, peer-run organisation. So we have lots of people who've kind of had lived experience of hepatitis C working right across the UK to engage people in testing, in education, in harm reduction and in hepatitis C treatment.
Colin, apart from making delicious cookies.
Hi there, everyone. My name's Colin. I have lived and worked on the scene for a number of years. I have friends from all walks of life and I've heard stories you can't even imagine. So I'm here to volunteer for Patriic and to give some feedback.
So today's basically going to be a conversation. We're going to try and ignore the camera as much as possible, but don't worry, we love you. Thomas is pointing at me for some strange reason. The clock's in the way. We have to get the clock off the table. Apparently that's bothering some people. All right, okay. So, right, okay. This is the second time we've been with Constellations. It's lovely to be back. The last time we were here, we were talking about Chemsex and harm reduction in Greater London. Is this right? This is what we wanted to do. Fine. Get very forgetful. And since we're here, a year has elapsed, and I'm really excited to say that we have finally been afforded a grant, which will allow us to deliver a safer Chemsex campaign across Greater London from January onwards, hopefully to last for 9 months to a year. It's not just about Chemsex. It's some quite harm reduction messages within the context of Chemsex, but also there's health and well-being, mental health stuff, stigma, hepatitis C. And what we thought we would do, because we couldn't think of any other way to do this is more or less the pack that's going to be going out. It's kind of in development now, and because we're going to go through some of the leaflets and why they're all here. And if the technology we have here today works, every time, let's just give it a go. If I want to talk about HIV and hepatitis C risk meter, Tom is going to put a link in the chat, and then Lucy and Maddie, by magic, are going to put that into your chat, and you should be able to open that up as a PDF. So if you like, you can not see us and just enjoy our mellifluous words. Equally, you can just watch us from a distance and wonder what the hell we're holding up. So, right, that was a bit of a balls up. Where should we start?
I thought that was marvellous. No, it was very good.
What should we start on? What do you want to start?
Well, I thought we could start with you telling us a little bit about what this is and sort of where it's come from. How have we got to this? Where was the idea? What is the journey you've been on?
When the Gay Men's Health Collective made its Chemsex pack, its PIT pack in 2014.
Yeah.
The contents of that literally was a square sheet of A4. Square, you know what I mean, square. And that single double-sided photocopy turned into a whole range of harm reduction literature. But at the same time of having information around safer Chemsex, we suddenly realized we needed stuff on hepatitis C, drugs and the law, health and well-being, your rights on arrest. Yeah. And so the pack just got filled with these wonderful resources. But the other thing that we've had unanimous feedback about is that while everything seems to be online these days, people like holding stuff. They felt valued, thinking that they could pick up a booklet or a leaflet and say, well, you know, this is actually for me. So while all our literature is online, the pack we will be distributing next year will all be printed. That's around 150,000 leaflets and booklets in this rather very simple but quite deliciously printed envelope. So as part of our work, we've always had an interest in chemsex, particularly harm reduction for gay men, gay and bisexual men, and other men who are sex with men. And I will abbreviate that to gay men because otherwise I will lose the will to live. We've decided that the best way to do, we piloted this pack in an accident and emergency department in London. And these packs were done out to A&E admissions, overdose admissions. And the feedback was the resources gave the nursing staff a great place to start in terms of which questions to ask. The patients felt valued. They were not expected to be given a gorgeous pack with information with which they can hopefully make better choices. And then when they left, when they were discharged, they could actually take the information away with them. And up until that point, most patients that were discharged, if they weren't admitted for perhaps further treatment or support, they would literally leave the hospital with nothing. And the plan is that with the help of these packs being distributed to drug services, sexual health services, A&E, police stations, HIV organizations, LGBT organizations, the plan is to get 20,000 packs out in around 6 months and start a conversation. And the reason why we have other information other than chemsex is because it's all about, particularly on the LGBT plus scene and hooking up, it's about hooking up safer. And some of these components are about chemsex, some of them are not.
But it's all about harm reduction.
It's
and
all about harm reduction
and keeping them healthy.
Did I rattle on too much?
No, I thought that was very comprehensive. I was thinking though, when you were speaking, a question I've never asked you in all our many conversations: how important do you think it is that it's beautiful, that it looks nice? So I'm just thinking about, quite often you go and you get a tatty leaflet, maybe it's photocopied, it might have like a bit of snot on it, and suddenly you're creating something, you're giving somebody something that's really nice, and actually in an area where people are maybe have faced a lot of stigma, they've dealt with a lot of challenges, the fact that it's quite beautiful and quite beautifully designed, suddenly when you were speaking, it struck me as something that's really important.
I suppose I'm old school. And again, I mean, I feel slightly bad telling this story, but I remember when we went to some drug services in London, we were doing some mystery shopping, seeing if we could walk into drug services off the street and say, please, can we have some pins, needles, syringes, swabs, and some condoms and stuff. And by most in part, they clearly wanted to engage with us, but some of them were really, really good and just allowed us to go in and get what we wanted.
Yeah.
But that part of it was good. But what we left with was a photocopy of further information that had been photocopied 16 million times so you could barely read it. And everything was thrown into a grey plastic bag.
Yeah.
Now, I've always understood, and this has been my journey, having got involved in harm reduction only in the last 10 years, I completely understand that harm reduction is the poor cousin to just about everything. Yes, exactly. So I understand why services are unable to send people out with their paraphernalia in a box with a bow and a cookie. But I also understand that if you want to engage your audience, if you want them to feel valued, if you want to provide a space where they can actually pick something up and say, well, somebody's put some effort into this, and yes, this calls to me and makes sense, then I think some love and care, dare I say it, even in these challenging times, is what you need to do. And we're volunteer led and run. It looks incredibly expensive. It's actually not. I just spat over you, by the way.
Thank you.
I have been vaccinated.
Excellent. For everything.
But this entire pack that we're doing comes at around 65, 70 pence.
Amazing.
And we go out of our way to get the best prices. But we've been told time and time again, when people pick up these things, I feel valued. And I'm going to stop there because you and I have talked about this. And the first time you saw some of that stuff, I think you were quite surprised, weren't you?
I was, absolutely. I mean, it's almost a holistic approach to not just Chemsex, as you said. There's health and well-being. There's.
Shall we see if the technology works? If we look at our Safer Sex booklet, if you want to put that in the chat, God willing, if you believe in that, please
I've got the
click
chat
on
here
that.
so I can see if anything
If you can click on that.
It says no messages yet at the moment.
Oh.
Drum roll.
Drum roll. Drum roll.
Getting a thumbs up from Tom. I don't know, maybe I need to refresh my page.
Sorry, we don't. Apparently, you're not supposed to do dead space.
Oh no! Now I've just made us massive.
Okay, she's just lost it. Okay, it's working. Apparently, it's working. Sorry, I interrupted you. So you were looking at the pink booklet.
Yeah, absolutely. I mean, if you scroll straight through to the back, so some of these links, the QR codes, are things I would never even consider until seeing this. So it's a great kind of resource to have. I mean, the very, very back page.
So if you scroll to the back of the booklet, there are a lot of QR codes and information, and you're looking at that.
Yep, for organisations, for clinics and services, mental health matters. There's a plethora of websites. So there's a real kind of good, strong base for you to be able to refer back to. Like when you said, when someone's getting discharged from A&E, for instance, they've been given all this information, all this, what you should do, what you shouldn't do, blah, 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 blah. To be given this pack and then be able to refer back to it is, I think, it's amazing. Something you touched on earlier about the packs being beautiful. Personally, if it's something that I want to keep, I would prefer it to be snazzy. And I mean, I know people that would turn their nose up at bad design and would throw the I do know people like that.
But we've all been there, haven't we, where we got the kind of multiple times photocopied tatty old bit of paper, and yeah, I mean, you don't really read it, do you? But it does, and it kind of indicates a sort of investment in the person.
I think that's so important, and I think yes, I want people to feel valued, and that apart from anything else, they're having a shit time quite often, and to get something that makes them feel understood that little bit better with helpful information, which they can go back to time and time again, just seems incredibly important. So that was is that probably your favorite booklet?
Absolutely, yeah.
Did you have a favourite booklet? Oh, am I putting you to? Did you have a?
I was trying to find the Hep C one actually, and I think it's not in my pack.
Oh, yes, the Hep C one. Can you put that in? Yes, he has a douche noddle up his ass. That's one of our most requested pictures, by the way. Sorry, okay. How can you go from douche ass to what you're going to talk about?
Indeed. No, but actually, I mean, what I wanted to say and what I was thinking about earlier was I love the pack. I love the fact that it's everything that you could possibly, so it's the full gamut of the information, and it's a properly, you've thought about where is the person, who needs this, and what information do they need, and it's not one thing that they need, and then there are 28 things that actually haven't been addressed. It's really person centered, and I suppose a lot of the conversations that we've had around harm reduction for this population and kind of more generally is that often that kind of what is the human being at the center of this, where are they, what do they need, and how do we support them properly.
Absolutely. It's like a sliding scale of you've got the information, albeit in the larger book a little bit dense because it's been well thought out. It's everything you need to know. Yeah. Down to the flip side of that, which is overdose and calling 999. You've got literally a flow chart, so it breaks it down. If you're in the instance where you need to call an ambulance for somebody,
Tom, if you could pop that in, please, kindly.
You need something.
I'm doing a thumbs up. I'm still not seeing anything on my chat, but we're going to ignore that for now.
You need something that's broken down step by step, nice and easy.
Yeah.
I mean, I've been in a situation where your brain literally just freezes, and you don't have the time to freeze up. So something like this, if you've got a note, a pin board in your kitchen, just keep it. I mean, it's going to save somebody's life.
I remember at the last session there was a comment in the chat about someone saying they had like a phrase that they trained people to use when they needed to call an ambulance. So it was like it kind of takes away that thing of like, what am I going to say or what do I need to do? It's just, it gives you that really kind of simple, just
mantra.
Yeah, so you don't have to think about it because actually
Muscle memory.
Yeah, because it's so difficult, isn't it?
And that ties into what is an incredibly challenging issue in everywhere I know. And again, the learning curve for me has been very steep about gay men will not call 999. No, not all gay. Some gay men will not call 999 because if they call 999 for an ambulance because somebody has died or they've overdosed, they won't call 999 because they are fearful that the police will turn up. And we're just starting to have, I would argue, a more intelligent conversation of what that might look like in a year or so's time. But I am certainly aware. I'm certainly aware of cases where people have died because an ambulance has not been there in time.
And I think there's quite a lot of evidence around that in opiate injecting and people delaying calling ambulances because they're worried about it. Someone in a recent meeting was talking about a survey that was done of university students just quite generally, and I cannot remember the statistic, I was trying to find it this morning, of the proportion of people who wouldn't call an ambulance so they're 20-year-old kids or whatever who are experimenting with stuff, and again they wouldn't call an ambulance. A good chunk of them would really hesitate to call an ambulance if it was an overdose situation. And so this is stretching right across the board. It's a very kind of common issue, isn't it, that we need to find a way to make sure people feel able to do that.
I was lucky that I have good colleagues and peers around me, but for a moment I could have thought, oh my gosh, I've just discovered something absolutely brand new. And then of course you look back at the long rich history of harm reduction and drug use in this country over recent decades particularly, and realize this whole issue about calling 999 is as prescient today as it was 20-30 years ago. It hasn't changed.
No, absolutely.
And the dynamic between what the police feel they need to do, what ambulance services can do, the interaction when people call a call center. There are no clear answers, but I think there are conversations now which I didn't think would happen even a year or so ago, that will start looking at this more seriously. Because I keep saying, and I've said this very honestly to police officers, I said, well, and again, it's a brutal thing to say, but, how many more gay men do you want to die because people are not calling 999? They are frightened of you. But we don't want we don't want people to be frightened of the police, but they are. What are you going to do about it? And I appreciate that's brutal and it's harsh, but we're having those kind of frank discussions now.
But it's also hard, isn't it? Because it's in a system and their job is to deal with things that are illegal, and drugs are illegal. And therefore, if they're in that situation, it's
yes and no.
Well, it's
yes
no. But I
mean,
it will come down to individuals, or
sure. I mean, a conversation we had earlier about the I can't remember the wording of this now, but finding a needle on a staircase, offering that to somebody who's responsible
in a shark bin, I think,
to be able to dispose of it responsibly. How do you weigh that up? Steps need to be put into place so that there's a more even answer to that problem, not about the syringe found in the stairwell, but about how do people calling an ambulance, how does that then have a knock-on effect to them being arrested because somebody's, God forbid, died? There needs to be steps to be put in place, but the conversations need to be had first to work out.
I think they are, aren't they? I remember Bob talking about how
we are having these conversations now, and I mean, I wouldn't say I'm imposter syndrome, because there are many titans that have come before me in the field of substance use and harm reduction. Being fortunate is not quite the right word I would use, but we have found ourselves in a place where we have an opportunity to have these conversations again. And I think because every life matters, but I also feel that some of the deaths that have occurred as a result of chemsex, of drug use, or problematic use, really have resonated with people that desperately now want to find if there's a better way. So, that was sad.
I was going to say, this is getting a bit dark, isn't it? Should we cheer ourselves up a bit?
One of the things I'm gonna jump in here.
Go.
Completely. One of the things that we've done is that there's a booklet called Hook Up Safer, And I think we're quite chuffed with this one. This again was, designed and prepped by volunteers. This is now in its, I think it's fourth edition now. And it's a tricky one, but when it comes to meeting other people for hookup, for sex, for all that kind of stuff, we just came up with 12 tips. And again, it's proved a very popular resource. It's going to be in the pack. Do you have a fave? Do I have a favourite one? I think the one I think that resonates is that let somebody know where you are.
Absolutely.
And I think where that's quite challenging for people is that some of their friends may not know that they hook up. Some of their friends may not know they might be into drug use or chemsex. They may not feel they have a network of friends around them that will be supportive if they say, well, I'm going to go off and get my,
X, Y, and Z.
I'm going to be shagged into the ground here. Do you mind taking my number and or something? If I don't call back, whatever. I mean, I think, but I think that's my favourite tip, because I think let people know where you are.
I have a friend that occasionally just texts me a postcode, and then the next morning he'll say, "Sorry, I just didn't feel 100% sure."
Yep,
so it's
very
like
sensible.
It's painless, and it can. Well, worst case scenario you don't want to think about, but it's a very good safety kind of precaution.
Absolutely. I like that if you're using drugs, know what and how much you're taking.
Which
Pace yourself and take breaks. It's not rocket science, most people know that, but it's a very sensible thing, isn't it? It's just it's non-judgmental. We know what people do and what's going on, and you need to do it in as safe a way as possible. So
the last one I think I quite like, my second one, is actually when hookups don't go to plan, we don't often talk about it when it goes wrong. Chatting through it with a friend can help. And I think quite often, hopefully most of the sex we have works well, and we're happy and we're sated, but sometimes it doesn't work. And just being able to chat through with a friend, it can just helpfully start to ease the load a bit. And that might mean maybe you also call up a helpline. I don't know. Go on, sorry.
In situations where a hookup it's not gone south, but it's not worked. It's not worked out, and you don't want to just run off because it seems really impersonal.
Yep.
Sit and have a cup of tea with them. Get to know them. I've met some really fantastic people that I've become friends with because a hookup hasn't worked. So it doesn't have to be so like look at it in such a negative way. Something great can come out of it.
And it's also just that little bit, because we were talking about the mental health dimension, all of this as well.
Yes.
And having people to talk to, being able to talk to them about your experience and how you're feeling and all of that kind of stuff is just, it's so important for everyone in life, isn't it? And I think often we miss, in the physical health side of things, we often miss the mental health side, and it's so important, isn't it? It's
Yes, and I think we have to continue, particularly in the UK, to beat the drum louder than ever before. It worries me slightly that we're still getting sticking plasters over what people perceive as being mental health support. So we need to advocate without any shadow of a doubt for, that mental health support works, it exists, and meets the needs of the clients. Yeah. One thing I need to say, a little bird told me before we started this session that people, they're not asking questions.
That's true. Yes. And they haven't yet.
And they've not asked a single one. So you're either in shock, you're bored to death, you've gone off to make a cup of tea. But if you can think of anything you want to say,
even just say hello. Even
just say hello. Say hello.
It's so funny doing these things, and you feel so like you're just
in a room. Looking at the camera lens. It doesn't look as though we're lonely. We're not. But do say hello to us. And ask a question. Absolutely. What's next?
What is next? I want to know what you're going to do with this. Where's it going to go?
The plan. Okay, so if you put everything together, everything goes in the pack. Oh God, this is a mess. So
I like that we're all doing it. Like
we're
following your instructions so nicely, Patrick.
So the plan is that we're updating all of the literature in the packs. They're going to be all the literature will be updated over the next 2 or 3 months. Hopefully by Christmas, it will all go off to the printers, which is it's the biggest print run we've ever done in our lives. And then when they come back in early January, we start making up 20,000 packs. It's a little bit of volunteering that I've not told Colin about.
Had a feeling.
Literally putting them all in the envelope.
Yes, they all have to be
Wow,
packed by volunteers.
Awesome.
But because of the work we've done on our health and wellbeing website, and I'm going to scoot straight back to our leaflet on health and wellbeing. Excuse me. Our health and wellbeing website, manorus.co.uk, we keep up-to-date listings of drug services, sexual health services, A&Es, whatever. And we're going the extra mile now, because although we have names and addresses, and in some cases some named people, what we are doing is that we're going to contact every single service. I'm going to go on a coughing fit in a moment. We're going to contact every single service and get a named person. You need to talk.
All right, I'll talk. This is actually my favourite one. I was looking for this before. I just love the design of this one. Is this in the chat, Tom? I'm still not seeing any of them. We need to do some behind the scenes work around this. But the central page.
So it's the health and wellbeing leaflet, and it's the centre page spread.
Which is just such a
which
lovely.
Is gorgeous.
It is. It's beautiful.
It's a smorgasbord of goodness.
It is.
The reason why I mention that is because, and again, look, this is just a, oh God, this is a rabbit down, this is a go down the rabbit hole. Because our website's so large, one of the things, and again, you know, I've got OCD and I revel in it. We update our listings. We update the information on the website just about every single week. So we want to make sure, we want to do two things. One, if anybody clicks a link on our website elsewhere, they're 3 clicks, they're no more than 3 clicks away from the information they need.
Yeah.
We don't want dead links. No. And the most important thing is that you know, we have all the listings of all the police stations, the custody suites in London, sexual health services, LGBT organisations, and we're pulling all that information together and then taking it to the next level by literally phoning up, emailing, barracking them if need be, saying we want a named Chemsex for LGBT plus lead.
Yeah.
This is the campaign that we'll be delivering from the end of January. And because we're also working with some of the larger drug services in London, we've also got them who will also be willing this campaign into life and helping to let services know when these packs arrive, don't throw them in the bin, share them, use them. If you need more, ask for more.
Amazing.
Is that the...
Yeah, and I was just thinking, so we were hoping that Helen Corkin could join us, and she's in the HSA, the sort of public health lead for sexual health in London. And when I was talking to her about this, she was talking about the you know, the building that bridge across the drug services and the sexual health services, you know, to make sure that everyone understands what everyone else is doing, and that everyone can have a kind of effective conversation that they feel comfortable with, and all of those sorts of things. And I wonder whether this could be a really good opportunity to work with those drug services. And, you know, it's like everything in London. I think there'll be some that are absolutely amazing at this already, and there are some where, you know, and there'll be staff, you know, who will not be very confident having these conversations, and having this as a vehicle,
a conversation starter.
Yeah,
yes.
But also, you know, educating people. I mean, it's not something, if you're very used to dealing with harm reduction in a opiate sense, then you're not necessarily going to be terribly comfortable talking about this.
I think I said this the last time I was here, but it's worth saying this. This might alarm you. I think you know is that, and I'm happy to be told I'm wrong. I want to be wrong on this. But apart from the work that we do, and I'm not suggesting we're the best, but I actually believe we're the only, and I don't think there is any harm reduction resource material like this in London at all. No one's done a campaign. And I kind of understand, because everything's been treatment focused.
Yeah.
We've just got through COVID. These are challenging conversations, full stop, anyway. And I think the way that many of us are funded and expected to work make us less collegiate than we should be.
Yeah.
So if nothing else, dumping 20,000 of these on the streets of London, I hope will start a conversation. What else did Helen want to say? Did you have a string of things, or was it just... Have I exhausted you on that?
Don't put me on the spot with that.
But again, going back
stories,
to what you were saying before about the information being there, it being on the website only 3 clicks away. That's the beauty of the pack. You've got some of the stuff that's more in depth, so you've got time to mull it over. You've got the leaflets that are boom, boom, boom. These are the steps you need to take now. You know, when someone's at risk of losing their life, or God forbid. You've got leaflets on health and well-being. It's like, this is important too. You know, guys that can be isolated, can be alone, can meet up for a hookup. It could go wrong. They go home. Who do they have to talk to? Well, you know, these packs kind of bring people together. They're what am I trying to say?
Conversation starter again.
Conversation starter. Yeah, again, going back to the nurses in A&E.
Yeah.
Start having this to be able to hand out to somebody. It's a place for them to start a conversation about something. Let's say, I personally don't know that much about hepatitis C. I need to do my homework. Absolutely.
She knows everything.
So having that pack for someone that doesn't know about hepatitis C, for instance, this is a gateway into an education about it. And you know, the same about health and well-being. If there's, you know, someone that is isolated and they do go to A&E, this is a place where you can put people in touch, you know, with people that are coming off drugs, for instance, you know, stepping away from the chemsex scene. It's
No, I was telling you before, years ago, I ran a project training pharmacists to test for hepatitis and blood viruses in pharmacy settings, and it was really interesting talking to them as they kind of got into the project, as it were. And there was always one of the kind of bits I tried to hammer home in the training was like, do your first test, do it pretty much as soon as you can. You know, the moment you have a kit, the first person you think that might need testing, just do that test and have that conversation. Because once you've had it once, it becomes something that you feel you can do, you know, and then you can talk about it more and you learn and you chat to people and it becomes, you know, much more part of your practice. But we had lots of, I'm sure, very marvellous pharmacists doing lots of other work who managed to kind of just not quite do it each time, didn't quite want to have that conversation about blood-borne viruses. It's difficult. It's not something, you know, so getting someone to a point where they're really confident talking about a new area and raising that regularly with people, or maybe not that frequently. You know, I'm sure in lots of drug services and stuff, they might not come across lots of people who are coming in there to do needle exchange with, in this sort of context. But actually, you know, kind of getting yourself over that first hurdle is so important, isn't it, to building that confidence and getting it as part of your professional kind of repertoire, I suppose.
I've also heard that, again, this is something I've heard from colleagues who do harm reduction, who do training, is that one, particularly in pharmacists and chemists, that firstly, does your pharmacy does actually have a adequate space where you can have this conversation with a degree of privacy. Yes, and what they said was it was incredibly difficult to get the pharmacists out on training, to do any training.
Yeah, that's all really tough as well.
That is incredibly tough. So even if you can get them on the training, it has to be hopefully of a stellar standard. But then the pharmacists need to think, well, is there anything I need to do to actively encourage people to come in and feel that they feel welcome, they're valued, and there is a space where we can talk about something.
Yeah. But I think there's something about getting that person into the room. You need to have a sense of confidence and a sense that you feel like you know what you're talking about. And once you've done it once, it's just much easier, isn't it? Absolutely. And I think having something like this, if you're a nurse in A&E or something, and you've never talked to anyone about this, it's, you know, it's a new thing. You're probably feeling not that kind of solid on your feet. You know, having a resource and being able to use that as a way into that conversation is really valuable.
And as you say, every conversation, each time you're learning, the person's reaction, for instance. Oops, I didn't say that quite right.
It's a minefield as well, the language and, you know, what you're supposed to say, what you're not, how you refer to different things. It's really difficult. So I think that's brilliant.
Two things. Has anybody said anything in chat at all? Or are we kind of talking?
Maybe there's no one here, Patrick. Maybe there's
no one there. I have questions. Oh my God. Okay. Before I forget, listen, I'm going to get in so much trouble with my trustees, but I want to make an offer. We know that Constellations is around the world. And these packs are not spectacularly expensive to send out. So if anybody would like one of these packs, and I'm going to give you an email address, it's so easy peasy. Send us your email, send us an address by email, and as long as we don't get inundated, no, we'd be very, very happy to send you a pack. The address, I've been told, Tom's looking at me, he always thinks I'm going to get this wrong. It's admin, surprise, surprise, admin at gmhc.co.uk. Admin at gmhc, stands for Gay Men's Health Collective.co.uk. Drop us your address, say hi, and we will whack you out a pack. That rhymed. Tom, you said there were questions. How do we get them?
Tom's going to have to do it because I cannot see them on this.
Okay.
Is there any sense on smoking rates in the Chemsex scene?
The only piece of intelligence that we have at the moment, and again, you see, this is the trouble, how much I can give out. My understanding is that GHB and GBL has been overtaken by crystal meth on the London Chemsex scene.
Okay, interesting.
And that's borne out by intelligence we've received from other services. And we've corroborated ourselves. Why am I looking at you? No, what's your sense?
Was it? I think I must have misunderstood the question, because was it smoking in general?
I'm not sure if it's smoking in general or smoking drugs. It doesn't.
Oh.
Okay.
So I guess.
So
I understand was that GHB and GBL has been overtaken by crystal meth, which, if you look at other countries, perhaps is not so surprising.
Mm-hmm.
My understanding also is that while there is clearly an embedded slamming or injecting scene, the whole thing around smoking is slightly more relaxed and chilled and social.
Absolutely, yeah. So
I'm looking at you to comment, for God's sake.
Well, I mean, it is a much more relaxed way of the way it's viewed is more relaxed, more generally accepted. I think that people would smoke crystal meth rather than inject it. Personally, for me, it feels like a very big step up.
Cigarettes.
Cigarettes. So it was about smoking. Well, I mean, there are people I've chatted to that have the fetish for smoking cigarettes, not necessarily cigars. I mean, cigarettes in general. There was a gent that asked me if I smoked roll-ups or cigarettes, and well, anyway, the conversation went somewhere else. Statistic-wise, I'm not sure how you would factor that in, because it's kind of a legalized drug, isn't it, tobacco? So it's compare it with drugs that are still illegal and haven't been legalized yet. It's a tricky one.
Do they have a follow-up on?
I have another question.
Oh, marvelous.
So somebody works in a conservative state in America.
Hello.
And harm reduction is very new for them at the moment. Is there any way of having a conversation at a state government level?
I could answer that a bit, and you could answer that a bit, because we've had. I think the sorts of conversations you're talking about, we're starting to have here now. Would you agree?
In terms of
harm reduction.
Yeah, I mean, I suppose we're in quite a different situation, aren't we? Because while our harm reduction system is by no means perfect, it's very established, isn't it? We've had things like needle exchanges for a very, very long time in this country. Whereas in lots of other parts of the world, and I believe parts of the US, it's illegal. Distributing crack pipes in the UK is illegal. So I think
I can answer your question. Sorry, I've had a brain fart. If you can send your message to admin@gmhc.co.uk, there are a couple of organisations in America that kind of do this. It's kind of out of my wheelhouse, but I know of good people that do this, and I cannot think of the acronym, but there are two organisations I should signpost you to. Isn't that hopeless? Send me an email. I promise you I'll let you know who these organisations are.
And I suppose there are kind of different ways of having that conversation. And in the UK, I think we have done a lot of work. Our public health system has done a lot of work to try and understand the harms and the impacts of drugs and of all of the things that are related to harm reduction and the opportunities that harm reduction offers, and therefore, so taking a very kind of evidence-based approach. There's quite a lot of countries where you've got some quite great examples of how kind of different types of drug policy, different approaches to things like needle exchange, supervised what are they called? Injecting sites.
Consumption ones.
Yes, all of those sorts of things. Overdose prevention sites. All of those sorts of things. There is the kind of building the evidence base, gathering momentum. Getting the medical colleges and things like that on board in the UK is really important. To really build it into the understanding of people that this is about keeping people healthy, and this is about taking a public health approach to drugs. And you need to, for us, that's been a kind of very, very central part of building this up. I don't know how it works in the US and kind of how much.
I look at me coming out with stuff now in my brain. We're going to do some training in November, and in England. And we sent them a questionnaire. We sent this organisation a questionnaire saying, please let us know what you want to know, and we'll dovetail that into the outcomes, the learning outcomes that we propose. They were really, really good. And what they hadn't thought about, this was a drug service. I said, have you thought about asking somebody from the Met, from the police, from sexual health, a local commissioner, somebody from local government? And they were kind of said, oh my God, this is so obvious, we'd forgotten about it. So I've just got the participant list for the training session we're doing in November, and it's gone from 10 to 21. And there's some really excited people saying, thank you for inviting us. This is mental health services. So what we're going to have is hopefully a holistic approach to this problem.
Yep.
And we'll be talking to people. We'll be hopefully training and making aware people who are stakeholders within local government.
Yep.
And once that starts, then you can start taking it to commissioner. So the answer is start small, find your allies, have events, and build up from there. I don't know if that helps. It's just my brain going off. Another question. Look, I see questions.
There are people
lots
here.
of questions.
Marvelous.
I can't see it because my glasses.
This one out.
Go on.
We've had the 60s and sex, drugs, rock and roll. We want to use these learnings and not go back in time. It seems that we've gone back to the past, and it seems that talking about sex and drugs, people look at you like you're not human.
When I started doing HIV awareness courses in 1985, I realized relatively swiftly, I was such a handsome young thing then. I remember going to these training sessions, and when you wanted to talk about HTLV3, as it was then, it then became HIV. At the time, if you were following the Hep C guidelines for HIV, you kind of were covering all your bases. So without in any way diminishing what people need to know about HIV per se, you could kind of put most of that on the postage stamp. What we ended up doing for the rest of the day is talking about what people felt, their values, their backgrounds, how they were going to integrate this into their work, about death and dying. And roll it forward to sort of 2016, 17, 18, 19, we do Chemsex training days. We call them an introduction to Chemsex. What people need to know about Chemsex is relatively straightforward. What people need is the space, the safe space, dare I say it, to talk about this stuff. And some of it's done. I think probably the funniest, the most resonant conversation I had where I was doing some training in Wales, and somebody said, can you please tell us about lube and fisting? And I don't quite know why, but the first thing that came to my head is, which type of lubricant are you talking about? So there were about 40 people in the room, and we started having a very interesting but heartfelt conversation about the different types of lubricant you could use during sex. And that was incredibly helpful for some of the workers, because they felt, right, I've had conversations with gay men who have come in requiring support. They've talked about body sex and dildos and bits and bobs. They've talked about why silicone lubricant is good, but so much more troublesome than a water-based lubricant. So sorry, I'm going down a rabbit hole, but I think it's really important that you're right. I think we give people the space to talk about stuff that even today people find really, really challenging. And if you can lure them in with humor, with acceptance, being non-judgy, and get people to laugh a bit while they're doing this, this is why I think our training is such fun. Is that okay?
There's a little bit more to that question.
Oh, sorry.
Nowadays, we could almost be arrested if we talk about sexualities. I'm guessing this is from not here. How do you not discriminate, and how do you support people in a case of need? Most learning happens among peers and not from government projects.
So
You please. I'm gonna
just because it's the word peers has kind of made me think
Yeah,
about
yeah,
some of
yeah,
the
yeah.
stuff I was thinking about with this, and that as well. So we employ lots of people who work as peers across England and Wales and Scotland, and in and supporting people into Hep C treatment and through testing and all of those kinds of things. But I was also talking to Helen about this morning, and she was talking about the peers that work in HIV across London, and I was thinking about this with this book as well, in the sense of she was talking about how the peers, you know, there's this point when you're first diagnosed with HIV or hepatitis, and it is incredibly hard. You have lots of questions, and the stigma and the shame and all of those things are all kind of surrounding these viruses, as it does with drug use, as it does with chemsex, as it does with everything else. And having people there who have been there, know what it's like, know how you're feeling, and can make you feel included and like you're not, you know, outside of the system, or you're a bad person, or however, you know, lots of health professionals and other people make you feel in those contexts, is really, really, really important. And I think that's one of the things, certainly with Hep C in the UK, we're really lucky with, in that we've got such a big network of people. So most people now, I would say, if they are diagnosed and they're quite kind of vulnerable and need additional support, we can provide that to them. And in terms of the information and opening up those questions and doing the, you know, and what you're talking about just now, you know, doing that training, you know, but you're doing it from a, you know, getting people to really understand it from a perspective of someone who really knows what they're talking about. They're not talking about what's in a book. You know, they're talking about lived experience and where you've been and what it's like living through this stuff. And I think that's really, really important, you know, making sure there is an active population of people, an active community
of peers.
Peers,
yes, of
people
peers,
who have been there and can genuinely say, you know, this is what it feels like, this is how you deal with it, but also talk to professionals and train them and get them to understand, you know, it's important to know the difference between different types of lube, you know.
So peers are absolutely awesome. I want to make a quick comment about, was it about the language? People being fearful about talking about stuff? Tom's in. I'm going to be, look, I'm 63 years old, and when I go and do training and stuff, when this comes up, I say, look, I'm going to fail. I'll do the best I possibly can. I will be as respectful as I possibly can, but I'm going to get things wrong. And I think if you go in with that attitude and you're willing to learn, I mean, oddly enough, one of my biggest bugbears, I'm going to get into so much trouble for this, is that, you know, is it LGBT? Is it LGBT plus? Is it LGBTQ? Is it LGBTQI? Is it LGBTQIA? Is it, you know where this is going. And there's, I completely understand. People want to feel included. People want to feel they belong. They want to be under this umbrella. But for those of us that maybe working as a peer worker, maybe we're staff, maybe we're volunteers, keeping up with this stuff is a headache, plus a headache.
But do you think someone, if you're talking to someone else with lived experience, does that part of it slightly dissipate? You know, because you're connecting with them on a different level.
I think if you connect with somebody with, you know, with respect, equally, one-on-one, and you're speaking as an adult to somebody, people can be very, very forgiving. I think, you know, and I think sometimes so much of what we hear in the news, I wouldn't suggest one moment is a storm in the teacup, but at the end of the day, it's about you and probably that person in front of you. And how can you best engage with them? How can you make them feel at pace?
Yeah.
And if you don't have an answer to a question, just ask. If your thing is pronouns, don't forget to ask people. You know, it's not complicated, but I think the world in which we live wants us to make it complicated. I think you just need to be true to yourself. You need to be honest, ask questions, be gentle, and be kind and be respectful. That's my answer. Look at that, cracking.
I want to hear from Colin.
Well, I was thinking, you know, going into a conversation with someone, let's say it's a peer who's got a question about LGBTQ, etc., etc., etc. It can be a bit of a minefield from the point of view of someone that is LGBTQ. Internally, it's like you can put your foot in it, you can say the wrong thing, you can, you know, rub someone up the wrong way just by, you know, using the wrong pronoun, and it can be tricky. But as you said, if you go into it with the point of view of respect and wanting to come out of it with a better understanding, then I don't think you're going to go wrong. You know, if you can have adult conversations where you're potentially learning or, you know, trying to better understand, then it shouldn't really go south.
No. Two things, Tom. One, how much time have we got? And are we getting questions? And the people generally, we run out of time.
People are very happy.
Are you happy?
People are saying, you know, well done, everything is really good. No more questions at the moment.
Oh, God. Can we go home?
A bit more time if you want it.
Well, why don't we,
About 20
we've
minutes.
done it, why don't we just, do you want to round up? Is there anything you wanted to say, really?
Put me on the spot. Why don't you? I don't. I mean, I suppose.
More tea.
More tea.
Yeah, go on,
Let's
tea.
have more tea.
I can say something if you want to think, so it's up to you.
Well, no, I mean, I suppose, yeah, for me, there is that bit about, I suppose, you know, and for me, I think certainly having people with lived experience involved in the distribution of these packs, in the conversation in London, is all really important. I think, you know, there is that. I think we were talking about it earlier. There are some really great services where we're integrating the kind of harm reduction and the sexual health and all of those things, you know, and starting to build the services, just like you've done with this pack, starting to build the services around the person. But it's not consistent at the moment, and there's a lot more that we could do. And I suppose there's that question about kind of how do we build those bridges, and how can we strengthen the kind of the way that services work overall.
But I think we know it's time consuming, and it starts with having a one conversation. It is slow. Oh, that was rubbish. I don't quite know what I just said just then. What did I want to say? He's doing tea. He's doing sugar in coffee. Tea, rather. I've only got a couple of things to say. Look, if you've enjoyed this, we're as mad as the box of frogs here, but we hope we've done something a little bit different. If this conversation has spurred you in any way, we're not precious about any of the work we do. Go to our website, gmhc.co.uk. We will share, we will help, we'll support as best we can. I think today was simply about chatting about some of the, we'd like to think, exciting work that we're doing here. The fact that we have finally seemed to have reached a point where we're actually delivering harm reduction across Greater London, which, given how long it has taken us to get to the stage, is just quite extraordinary. So we're going to crack on and do this. But if this is, you know, if we can assist you in any way, start having conversations between yourselves, our work is done. Any other questions? Can we bugger off now? Listen, very, very quick. So, do you know roughly where people are around the world, Tom? Do you have any idea? Oh, Tom's looking at, he said, please don't ask me that question. Final thoughts, or are you done?
I think I'm done.
I'm done. Happy. We've got T, you're done.
All right.
So from Leila, Colin and Patrick, we'd like to thank you very, very much indeed. I hope it wasn't too much. And I hope so much we hear from some of you soon. Thank you, thank you, thank you. How do we cut off? Do we say goodbye or something?
Goodbye.
Bye.
Bye.